Welcome back to our Dan Education series. We're talking about the heart, your health and diving, and we're now in chapter 4 where we're going to be addressing issues such as atherosclerosis, myocardial infarction involving the coronary arteries, and some issues that are particularly important to women. Keep watching. Ischemic heart disease. Heart disease develops 7 to 10 years later in women than in men. Ischemia is a term that means inadequate supply of blood reaching a particular part of the body. So ischemia of the heart means that not enough blood is getting to the heart muscle. It is almost always caused by atherosclerosis, which is a narrowing of the arteries due to fatty deposits on the inner walls. In the coronary arteries, which is the artery supplying the heart muscle, and is the most common cause of heart disease. The prevalence of ischemia increases with age. The first manifestation of ischemic heart disease, unfortunately, sometimes is already a fatal heart attack. But the condition's presence may be signaled by symptoms that should prompt life-saving actions. Knowing these symptoms can mean living longer. And preventing heart disease in general means happier lives without symptoms or functional limitations. Atherosclerosis is popularly referred to as hardening of the arteries and is the result of cholesterol and other fatty material being deposited along the inner lining or walls of arteries. The condition has different manifestations depending on which arteries are affected. It causes coronary artery disease in the coronary arteries and cerebrovascular disease in the arteries that go to the brain. It may also affect other limbs and may cause peripheral artery disease. The walls of the arteries, in response to the deposition of fatty material, also thicken, and the result is a reduction of blood flow through the affected vessels. These effects are especially damaging in the heart. Coronary artery disease is the leading cause of death in the United States and other industrialized countries. It's certainly prevalent in South Africa. Many factors contribute to the development of atherosclerosis, including a diet high in fat and cholesterol, smoking, hypertension, increasing age, and a family history of the condition, both of early heart attacks and high familial cholesterol. Now, women in reproductive age are generally at lower risk of atherosclerosis because estrogen protects them. Medications typically used to treat atherosclerosis may include nitroglycerin, which is the treatment for angina or chest pain, calcium channel blockers, and beta blockers, which are used in the treatment of high blood pressure. And we've spoken about this before in the session on hypertension. Sometimes individuals with coronary artery disease may need what is known as a revascularization procedure, which is to re-establish blood flow, typically either by a coronary artery bypass graft or an angioplasty. If such a procedure is successful, the individual may be able to return to diving after a period of healing, which is typically about 6 months, and a thorough cardiovascular evaluation. So let's look at the effect on diving. Symptomatic coronary artery disease is not consistent with safe diving. Don't dive if you have active coronary artery disease. The condition results in decreased delivery of blood and therefore oxygen to the muscle of the heart, and exercise increases the heart's need for oxygen. So diving is hazardous, and depriving your heart of oxygen can lead to abnormal heart rhythms and myocardial infarction or a heart attack. The classic symptom of coronary artery disease is chest pain, especially following exertion, and may feel like a crushing pain over the sternum and may sometimes spread to the jaw or to the left arm classically. But unfortunately, many people have no symptoms before they experience a heart attack. A history of stroke or mini-strokes known as transient, which means passing, ischemic attacks also would not be consistent with safe diving. Cardiovascular disease is a significant cause of death amongst divers, about 40%. Older divers and those with significant risk factors for coronary artery disease should have regular medical evaluations and undergo appropriate screening studies such as treadmill stress tests. Thank you for watching this episode, and please subscribe and join Dan if you're not a member already. And if you are, thanks for being part of the production of these education series.